Everyone. I'm Tony Land, President and Chief Experience Officer for Landing Exceptional Experiences. And welcome to Tony Time, where solutions are just a discussion away. Today, we're going to dig into another one of those solutions that organizations are often challenged to implement and sustain. And that one today is whiteboards. So we're going to dig into a Reddit thread where some of the nurses and techs on there are talking about whiteboards, the pros, the cons, do they like, do they not? So lean in and hear their perspective. So the question starts off, whiteboards? What's your opinion? I feel like they create busy work for nurses. I think they are a monumental waste of time. So that's how it starts off. That's the question that this person has put out. And so it starts out saying, outdated, as hospitals are moving to bedside tablets. Newer hospitals and hospital beds have bedside tablets for call bells and TV streaming service and video calls, etc. It is not a technological leap to put whiteboard information on the tablets via an app. I bet Epic has or is working on a My Whiteboard app right now. Besides, we all know patient eyesight is poor already, so putting a whiteboard far away from the bed doesn't help at all. And we know there is some technology out there that can do exactly some of those things they're talking about. And somebody said, I like having the nurse's name so I know who to call if the patient needs something or that I can't help with. And ours has a section for mobility, which is really helpful if I'm answering someone else's call light and I need to know how to take them to the potty. But the hyper detailed ones with discharge plans and pain levels that are next and PRN times and all that, we don't have all that. And I'd never fill it out if we did. Ours are pretty basic. Patient name, nurse and CNA name, doctor name, date, diet, mobility, bed and chair alarm, and then an open space for whatever. Another poster. They need to be simplified. Most whiteboards have too much stuff on them and they're way too small for patients to read. You really just need the date, nurse, tech, doctor, and maybe fall risk. I mean, it should take all of 2 seconds to fill out. We don't need goals for the day, patient preferences, diet, family members, questions, pain goal and meds, et cetera, et cetera, et cetera. The next thread was actually a little longer, but I'm included and I'm going to read it because I feel like it adds value. And this person says, I'm a little shocked by all the completely useless comments. Yeah, management needs to chill their boner about the whiteboards, and almost everything else on the unit should take priority. The attention they get is completely incongruent to their value. I don't need 3 sit-down meetings a week about an effing whiteboard. But you can take 2 seconds to write down your name for someone who will be completely reliant on you for the next 12 hours. That's a common courtesy. I've stepped into rooms with call lights on which the patient didn't even know the name of their nurse. This was halfway through a 12-hour shift. I couldn't tell them either because the name on the board was 2 days old. For those of you who have been in the hospital for longer than 2 days, it gets psychologically dark really quickly when you're alone. You begin to feel like a hostage. I've been a nurse for 9 years and I felt that way. Even with the intimate inside knowledge of how healthcare works, knowing someone's name, especially your nurse, it helps a ton. I'm not talking about exactly timely updates on med times or pain med schedule, activity schedules for the day or whatever, as important as all that stuff is. But your name? I mean, just admit that you forgot to do it. No one is so pressed for time that you couldn't write down your name. I thought that was very value add. She's coming from that nursing perspective, but also having been a patient herself. And then someone else says, I am the worst at filling out the whiteboards. But I'm also a little shocked by all the hate they're getting on this thread. I mean, like, honestly, name and date, not hard, bare minimum. I try my best. It's not perfect, but I can promise you the patients appreciate it. And someone else is in the ED, and they said in the ED, I totally get how it may not even be possible, or even make sense at times, but on the floors, come on, son. And then somebody says, as a patient, I relied heavily on the whiteboard. I had at least 50 different nurses, and it got harder to remember names as time went on. One of the texts says, I fill in what I can. I mean, I can't write what the plan of care is, but it helps sometimes if I haven't seen a patient yet and they ask to go to the bathroom and they claim they've gotten up to the toilet before. And when I look at the board, it says strict bed rest. And finally, it's a nice touch, but I think techs and secretaries can fill it out. So here we see this thread around the frustrations in the whiteboard. And I would even say some of the why around the whiteboard and some of the benefits of a whiteboard. So I'm going to lean in and talk just a little bit about the history of whiteboards. And so whiteboards have been around. From some of the literature, it says over 30 years. People have used whiteboards everywhere from the early days where they were called grease boards and used for staff communication. They were oftentimes used in operating suites where they were regularly updated with surgical patients going to which rooms and which staff were involved for, certain procedures. And then about 20 years ago, the Institute of Medicine started talking about an emphasis on patient-centered care and effective ways of being able to communicate with patients and with families. And whiteboards became part of that way to improve safety and experience for patients and their families. So I would tell you, for me, I remember a lot of our work around the whiteboards stemming from some work that was done with TCAB, or Transforming Care at the Bedside, a Robert Woods Johnson project focused on really how do we transform care so that we eliminate waste and we're more efficient while producing desired outcomes. So I remember from, way back when we were really doing a lot of work on whiteboards, that was one of the ways that it was being approached. So what does some of the research show us out there? And let's look. So let me see, there's one, and I wrote down a couple of notes here. So there's one study where it's asking, the question is, do bedside whiteboards enhance communication in hospitals? And this was an exploratory study of patient and nurse perspectives. And these links will be down below for your references to use for yourself and with your teams and family members as you engage them in this work. And so from the research, it said that 92% of the patients responded that they read the information that was on the whiteboard frequently, because it's easy to forget when you're in there and you have so many people coming in and out. So I can understand that. Patients indicated that nurse assistant used the whiteboard more often, 93% of the time, which that's not surprising for us that they would be the primary ones. And then they said the rest were, your physicians or your therapists. And I think if you're a unit that's active in therapy, your respiratory therapist, your physical therapist, occupational therapist, just depends on where you work, that those professionals also putting their names up there. Approximately 60% indicated that they knew they could use the whiteboard to pose questions or comments to the care team. And 53, or half of those folks, said that they had actually done so during a hospital stay. I can tell you we did when my mom was in the hospital. And 95% of the patients reported that the information on the whiteboard was helpful to them and their family members. Now, I think it's interesting, as we read several of the comments where people talked about how do we simplify it? It's asking for too much information. We don't have time to complete all of that. And so when this research, these researchers asked, what was the most useful information to have on the whiteboard? There were a couple that came out, rose to the top. 95% said the name of the members on their care team. And we indicated that up earlier, where it was, the nurse, the physician, the therapist. I would even say the secretary, because that's, if you have unit secretaries, that is often the voice that they are hearing most from, from the intercom. So I would think that would be a great one to have up there also. 87% said the current date. 80% said upcoming tests and procedures. 63% said goals of care were cited as most useful. And then less than half of the respondents agreed that listing meds on the board would be, beneficial. So interesting, when they were asked, would it be helpful to have a provider picture on the board? 45% answered, affirmatively. So just looking at what from the research are they saying is value add to have on that whiteboard, those are some interesting bullets to take away. So I will tell you, there was another research paper I looked at where they were looking at improving patient engagement, and they were actually using the PAM score, the patient activation measure. And so of the patients that participated, 84% agreed that someone explained the purpose of the whiteboard, like, why are we putting this stuff up here? 71% reported that the whiteboard was used to record their questions, and 70% confirmed that the whiteboard was used for their inpatient education, and 78% felt included in the whiteboard communication overall. So from that research, patients and families perceived bedside whiteboards as an effective tool for communication and collaboration. So just looking at, some of the research that's out there, and again, I will put these links below, you can see the value that it can add to everyone, patients and families and the team, as we look at the benefits of having, a whiteboard. Now, if we look at what are some of the goals around the whiteboard, we're talking about increasing communication. Even as we talk about goals for the day, that might be something what I've seen many teams use. It might be that you're going to walk in the hall 3 times today. So using some goals like that so that the patient knows, family comes in, family knows that my sister, my mom, my dad, whoever needs to walk in the hall to the nurse's station. So being specific, to the nurse's station 3 times today. Then, they can ask, hey, have you been up today? Have you already walked today? So it really starts to increase that communication, increases the adherence to these daily goals and plans, which hopefully keeps us on the road to being discharged in a timely fashion. So possibly impacting some length of stay, increasing safety, just as that tech said up in her comment, his or her comment earlier, that maybe they've gone in and not seen the patient, and the patient wants to get up, but it's on strict bed rest. So we look at safety and falls in some of those goals. And we can look at experience measures around communication and safety. So what do you do with this information? So just as I always say, when you're going back to that drawing board and kind of coming back and revisiting with the team and saying to them, we've heard you that current state, it's not working as well as it should. Let's first determine, what is the purpose of this board? Is it patient-centered? Is it team-centered? Is it both-centered? And I asked that question because I've done that work before, where we've actually gone out and talked to family members and talked to team members around the whiteboard, what's on it, and the purpose of the information that's on there. And one of the pieces was around, which the last video, I'll put the link below, the last video talked about hourly rounds. And so when we talk about what is the purpose of this whiteboard, is it patient-centered? Is it team-centered? Is it both-centered? Centered around both of them. I think that's important when you're looking to determine what we include on that board. I can tell you in my past, we've done some work where we actually went out and talked to patients and families, and we talked to team members. And this specific issue that had come up was leadership wanted a place for hourly rounding checks. And we talked about hourly rounding in our last video, and I'll put the link below, but they wanted hourly rounding checks on the whiteboard. So one of the things is we're looking at, what do we include? And it was many of the things definitely that were listed above: the name, the date, the caregivers for that day, your nurse, your tech. We included we include our secretaries on there, your physician or physicians, or at least your lead physician for that day. If you have hospitalist, who your lead physician for that day. So when we talked to the patients, many of them felt no value in having the hourly rounding piece on there. It didn't have meaning for them. As I think we thought maybe it would, they would know when we're coming back. So many did not feel like that was value add. And when we talked to team members, they felt like it was not value add to them to check off that box. It didn't mean that they had gone through any type of specific checks. And actually many related it to being in a restaurant where they've got it on the door, we've checked the restroom. So I think, having the right conversations to determine what is the purpose of this board so that you align design and goals accordingly. Now, we talked about some of the goals already around increasing communication. It helps increase adherence. It helps increase safety and definitely helps increase your experience. Utilizing technology when possible. We want to maximize efficiency for those who are out there serving our patients and our families. And it's easier for the patient also. So when possible, use technology, start to put those things in your budget so that you transition through the technology. That can be electronic boards. I've seen those out there, and I've seen iPads. And I think it said almost 50% of patients felt like there was value in having a picture of the provider or physician for that day. And many of the electronic boards can automatically pull those over. So that can be a nice add for everyone. And then, of course, reinforcing the why, tracking what we expect to see as outcomes and results, track falls, and then track some of the call bells and track whether patients know who their nurse is. So track some of those things so that you can see, is there improvement, and always get feedback. Get feedback from your patients and your families, get feedback from your team members, create a mock-up so that they can truly, team members and patients and families can engage with the new whiteboard and get feedback before you make that final decision. Also recognizing that it may look a little different for different units, like a postpartum unit, a pediatric unit, even an intensive care or intensive step down. So those things may look different than your typical med-surg unit. So I'm looking forward to your comments about whiteboards and what's going well in your units or at your organization, and what are still some current challenges for you so that we can talk those through. So don't forget to comment, like, and subscribe. This is Tony Time, where solutions are just a discussion away.